Are you pregnant and curious if you can have fish during pregnancy? Have you been really sad about going to your favorite sushi restaurant and you're not sure what you can have to eat there? It can be super stressful to think about sushi and fish and shellfish during pregnancy, so let's talk about it today. Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself in your pregnancy. I'm Dr. Lexi, a board-certified OB/GYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy doctor, and today we're going to talk about fish and shellfish in pregnancy. So I've had friends talk to me and visit with me during their pregnancy when they go out to eat and they're really nervous about what they can or cannot eat because of the fish that might be there. So some rules of thumb: you don't have to avoid fish altogether. In fact, fish is really helpful for fetal brain development because of the omega-3 fatty acids. So really good to still eat fish, about 8 to 12 ounces per week. The thing you have to think about is that you don't really want to eat fish that's super high in mercury. And what we're going to talk about some today is looking into the different types of fish that you should avoid. All right, so to expand your knowledge, let's answer 3 simple questions regarding fish or shellfish during pregnancy. Question number 1, is it considered safe? The answer to that is yes. And actually, it is recommended to eat on a weekly basis because the omega-3 fatty acids in fish and shellfish can help with fetal brain development. Second question, how much is considered safe, or how much is actually recommended? The general recommendation is 8 to 12 ounces per week of some type of fish or shellfish. And then that gets us into the third question. What type of fish in particular is recommended? You've probably seen or heard in the news or some type of social media even about types of fish that are not good to eat during pregnancy. Those would be any type of fish that are considered very high in mercury. The typical ones to avoid are going to be things like swordfish, tilefish, king mackerel, shark, and orange roughy. So those are kind of funny because some people might not know what tilefish are. I've actually seen a few of them because I lived down in Galveston and they had a fish market, and when you went down there you got to pick the fish pretty much fresh, and so you could see the fish fully intact, and they had tilefish rather frequently. And a lot of us won't be eating shark anytime soon, but I do put that on the list in case you're traveling and it ends up on the menu. Some of the other really good things about certain shellfish, like clams and like shrimp, is that they are high in iron. And it's really good to have a nice balanced diet with iron. Most people only get about 15 grams of iron in their daily diet. That's on average here in the United States. So if you're looking to increase your daily iron intake, shrimp can be one of those good things. The other thing is iodine is very important to get in your diet on a regular basis, and shrimp does have iodine in it as well. So there's some pros, not just the fetal brain development, but some other pros that we can see from eating fish and shellfish. All right, now that we've answered those 3 questions and expanded our knowledge surrounding fish in pregnancy, let's go on to developing some skills. So these are going to be some questions that you can ask. And I always like to start with one of the most common ones that's asked of me. And that question is going to be, can I eat sushi? So this goes into the question of, can I eat raw fish? And the recommendation is no. When people ask me about sushi in pregnancy, the big thing is you just don't want to have raw fish. Raw fish has the risk of carrying bacteria, specifically things like listeria. And we don't really think much about that when people aren't pregnant, just because really getting food poisoning is not terribly common. And when you get it, you know it, and you get sick, and then you typically get better. The problem in pregnancy is that pregnant individuals are more prone to getting this type of foodborne illness or this type of bacteria that causes what we call food poisoning. And because pregnancy is considered a type of immunocompromised state, if someone were to get listeria, meaning we even call it listeriosis, that's kind of like when you get sick from listeria. So listeria is the bacteria, listeriosis is when you get the infection because of listeria. So if a pregnant individual has listeriosis, the problem is they will get much sicker than someone who is not pregnant. And if you think about the side effects from getting food poisoning, nausea, vomiting, diarrhea, severe dehydration, those things can happen more readily and in a worse fashion in individuals who are pregnant. So that's why we tell people no eating raw fish during pregnancy. All right, and question number 2, what type of fish is okay For example, which type is low in mercury? We did talk about this in our expanding knowledge, but I want to make sure you understand if it's super high or high enough in mercury, you want to try to avoid it. Most of those are going to be considered the swordfish, tilefish, king mackerel, shark, orange roughy. Those are the more common ones you might hear. Again, the shark, not so much. And then the third question, what about tuna fish in a can? So the albacore tuna that you get in a can sometimes can have a higher amount of mercury than the non-albacore tuna. So if you are eating cans of tuna, 6 ounces per week of the cans. So you don't want to go over that typically because of the higher mercury that can be in those cans of tuna fish. Now, big eye tuna also has higher amounts of mercury. So typically on the cans, they'll oftentimes say low mercury, or you can look and see if they have actually listed any information about mercury on the can of tuna fish. So that's kind of helpful as well. So we have expanded our knowledge, we've developed some skills. I always like to then go into the impact. So what is the point of this and what's the impact that we're having? So number one is that you are understanding the foods that are good to eat and that you should avoid during a pregnancy for safety, which is fantastic. And then the second thing, I always talk about a happy and healthy pregnancy. So that takes me into number 2 and number 3. To have a happy pregnancy, maybe you want to eat certain fish, and now you know which ones you can or cannot eat. And if you're big on raw fish, certain types of sashimi, etc., maybe you can talk to the restaurants that you go to and be like, hey, listen, I'd like to have that seared a little bit, cooked a little bit. You really do want to get the temperature up high enough to kill any concerning bacteria. So talk to the restaurants and see if they can heat it up appropriately. You can see my other YouTube that's talking about cheese in pregnancy, and it really goes into more information with regard to how hot you should get the food. Then we get into the healthy part of this. And really, if you're eating foods, or rather not eating foods, that could have foodborne illnesses in them and cause a type of bacteria that gets in your bloodstream and makes you really sick, that's leading to a healthy pregnancy. So that's a huge part of all of this. All right, quick recap on everything that we talked about today, or at least a little summary of what we talked about. Number 1, fish and shellfish are safe in pregnancy if they are cooked, not raw, and we want to get about 8 to 12 ounces of that per week. Thing number 2, go for low mercury items. So avoid swordfish, tilefish, king mackerel, orange roughy. And thing number 3, because I don't want you to forget, no raw fish, no raw shellfish. Don't forget to check out your free download, drlexihill.com/advocate. And that's the 13 questions that you can ask to your provider at any time for any pregnancy. And don't forget to subscribe to the YouTube channel so you can see all the new information that's coming at you with all things pregnancy related. Also, you can check out the podcast, which is on YouTube, Spotify as well. As always, thanks for watching. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.